Assalamu alaikum everyone. Today we will continue our previous lesson, and today's lesson is vestibular nerve. That's the half part of the 8th cranial nerve, and today I try to give you comprehensive information about vestibular system. First of all, we should do some kind of review about the normal anatomy and normal structure of the receptors and the vestibular organs, yeah? And look at that. And in our previous lesson, we provided information about this part of the inner ear, and this part is responsible for receiving the impulses, sound impulses, okay? And this semicircular canals semicircular ducts is responsible for providing information about the position of the head, okay? Now look at that. And in one inner ear have 3 semicircular ducts. First one is lateral. Lateral is located horizontal, and another 2 ones are anterior, and posterior is located some kind of vertical position, okay? And the angle between these 2 semicircular ducts is 90 degrees, okay? Now all of the semicircular ducts is filled with and the lymphatic fluid, and the lymphatic fluid's main function is moving according to the movement of the head, and some kind of stimulating the receptors that's located in the ampulla. And if we talk about the structure of the receptors, structure of the ampulla consists of cupula on the receptors and some kind of sustaining cells between the receptors. And these receptors provide information about the movement of the fluid in the semicircular ducts according to the movement of the head, okay? Now, and the next structures are utricules and saccules. Their main function is providing information about the static position of the body, okay? And when we are standing and sitting, and according to this utricle and saccule send information to the brain, okay? Now, and that's their structure, and these structures consist of otoliths on the gelatinous membrane, and the gelatinous membrane cover the receptors, and the receptors located between some kind of sustaining additional cells, and the receptors generate action potential and send to the brain about our static position, okay, not dynamic. The receptors that's located in ampulla main function is conducting and sending the information about our movement, our dynamic position, but their function is sending the information about our static position, okay? And that is the nucleus, 4 nucleus structure of the vestibular nerve. And when the impulses generate and conducted enter to the brainstem, they stop firstly in the nucleuses of the vestibular nerve, okay? They are 4 nucleuses. First one is superior, the second name is Bacteria, and next one is lateral nucleus, the second name is Daters, and the medial one name is Schwalbe, and the inferior one's name is Roller, okay? And all of them participate in some kind of specific function of the balancing, okay? Now, before I provide information about that, I'm going to talk about 3 main structures that participate in the keeping balance in the human organism. First one is our visual system. By watching and something during our movement, our visual impulses try to send information our muscles according to the position. For example, imagine you are climbing on the mountain or running on the surface of the road, and doing something like that. And during this kind of situation, some kind of visual information try to keep our body into balance. Okay, that's first one. Second one is our proprioceptors. Proprioceptors that are located in our muscles, joints, always generate action potentials and provide information the position and tones of the muscles and joints to the cerebellum. Okay, by this way they help us to keep our balance. The last one is vestibular apparatus. Vestibular apparatus generate action potential according to our static position and the movement of the head. Okay, by this way this vestibular apparatus participate in our keeping of balance. Now, and there is some kind of fibers that's connected with other structures of the brain, and in this illustration I will try to give you some kind of straightforward information. First of all, look at that, and there is vestibular cerebellar fibers, and except lateral nucleus, all of the three nucleuses send the information to the cerebellum about the position of the head and something like that, and these impulses conduct to the cerebellum, more specifically nodulus and flocculus part of the cerebellum, and after that the cerebellum tries to analyze the information, and by this way the cerebellum sends the impulses to our muscles, and then as a result we can keep our balance. Okay, and I didn't draw there, and there is some kind of fibers that directly conduct to the cerebellum without stopping there, something like that, and these impulses provide information the activity of the receptors of the ampulla and auricular, and according to this the flocculus and nodulus send another impulses to the vestibular apparatus to inhibit and keep a balance of the function of the receptors in the vestibular apparatus. Okay, now that's vestibular cerebellar fibers, and our next fibers are exit from the lateral brachioradius nucleus, and we can call them lateral vestibular spinal tract. One of the main lateral vestibular spinal tract's function is sending the impulses to the alpha and gamma motor neurons. You know, the gamma motor neurons is responsible for maintaining the tone of the muscles, and the alpha motor neurons is contracting the muscles for doing some kind of activities. Okay, by this way the vestibular apparatus transmit some kind of information to the alpha and gamma motor neurons for keeping some kind of our muscles in the extended position. By this extended position we can easily keep our body in balance. Okay, now that's the lateral vestibular spinal tract, and our main two structures are medial longitudinal fascicles, ascending fibers and descending fibers. We should initiate with descending fibers. Descending fibers, the main function is transmitting the information to the spinal cord, specifically to our cervical and upper thoracic part of the spinal cord. You know, the cervical part of the spinal cord is responsible for moving our cervical muscles, contraction of our cervical muscles, and upper thoracic spinal cord's main function is contracting our upper limb muscles. By this way, according to the information that's generated from there, our organism try to keep the head in the normal tonus and in the normal position by contracting and some kind of directing the impulses to the cervical and upper limb muscles. And this function is performed by medial longitudinal fascicles, descending fibers. Okay, now our next fibers are medial longitudinal fascicle, ascending fibers. Ascending fibers connect with our three cranial nerves: third, first, and sixth. You know, third is oculomotoris, fourth is trochlearis, and sixth is abducens. three of them is responsible for the movement of the eyeball. Okay, and one of the main function of these fibers and these connections are matching the eye movement to the head movement. Okay, that's not any information. That's so simple, that matching the eye movement to the head movement. When we turn our head to the right, the eyes try to deviate to the left side. This is performed without any planning, and this is automatically performed the connection via the connection between these three cranial nerves and the vestibular neurons. Okay, nucleuses. Okay, now. And all of the informations are about the normal function and structure of the vestibular system, and I'm going to provide information about some kind of pathological conditions. First of all, I should note that, and we have some kind of pathological conditions. First one is oscillopsia. Oscillopsia is some kind of movement of the objects in front of the eye, and that's illusion, not real. Okay, and our next information about the motion sickness. Motion sickness is occur in some kind of vehicles in the sea or ocean, and maybe boats or some kind of other vehicles. And during your trip in the boat, some kind of situation may occur that some kind of mismatch can occur between our visual system and our vestibular apparatus. On the bottom of the boat, when you are sitting, the eye provide information about nothing is moving. Our vehicle isn't moving. This is information that's generated by our visual system. But vestibular apparatus can generate action potentials and provide information about the movement of the vehicle. And there is mismatch, and the motion sickness may occur. And our next information about vertigo. Vertigo's pathogenesis looks like the motion sickness. There is a mismatch between the proprioceptive and the vestibular and our visual impulses. Okay, and I know the two types of the motion sickness. First one is subjective, and second one is objective. And in one and in another one, for example, imagine you are rounding around the environment, and the environment is rounding around you, and that is the vertigo. And when the patient suffers from this kind of situation, first of all, we should about the abnormal function of the vestibular apparatus. Okay, and our last information about the athlete's negative function. When the athletes detached from the surface, and they may come to these parts of the vestibular apparatus, and by this way they can impinge on the normal movement of the endothelial fluid and can irritate some kind of receptors in the ampulla. By this way they can disturb the normal function of the vestibular apparatus. Okay, and all of the beneficial and useful information is all for you today. Thanks for listening and watching. As usual, I have some kind of questions and I have some kind of offer for you. And if you have any suggestions and offer and some kind of negative feelings and positive feelings about our videos, we are always ready to accept from you in the comment part of our YouTube channel. Thanks for listening. Take care of yourself. See you again.